Welcome to Weather and Wine, the video podcast addressing the pressing yet important topic of risk. Today I'm joined by Anders Tegnell, who is a senior expert within the Public Health Agency of Sweden. And today we're going to go through various topics, including the 4 megatrends that we within Aon see, being trade, technology, weather, and workforce. Very warm welcome, Anders, and I'm delighted to have you here to discuss some interesting topics, especially relating to the pandemic, of course. And the first question that I would like you to elaborate on is a little bit, what kind of lessons and insights from the pandemic led to important system changes in Sweden, according to you?
Yeah, I think we're maybe not quite there yet that we really see the long-term consequences of the pandemic yet, but I think what we realize is that this kind of crisis is a whole of society crisis. It cannot be handled by the hospitals or the healthcare services or even by the public health institutions and so on. Everybody must get involved. Not many of the different actors, and not least the population, also must be on board for us to be handling that kind of crisis in a reasonable manner. So I think that's one thing we learned very much. When you come down to detail, we learned that we can work very much on distance, like we're doing right now, and that we can work from home quite a lot more than we thought from before. And sometimes I think maybe that changing the work market might be one of the things that we're going to keep with us. And we also learned that we have weak spots in our society. We have a very fragile elderly care system. We have a problem with integrating newcomers into Sweden, into the Swedish society, and reaching them in different ways during a crisis. So I think there is a number of important lessons that we need to take with us and not forget now when we have different kind of crises. But many of them, I think, share the same kind of lessons.
And going to what you said, and I totally acknowledge what you say, that we are not perhaps all through the pandemic and we cannot know all the lessons learned from it. But also looking that if we say pre-COVID-19 and post-COVID-19, where we are right now, you mentioned the importance of collaboration between different stakeholders within the society. And where have the major changes been and how did it work? What is your view on that?
I think we went into this pandemic thinking that it would be a kind of health crisis. And of course it was, to a great extent so. But rather quickly we understood that maybe it, to a certain extent, needs to be handled by the health services, the many sick people and the testing and all of that. But many of the measures would involve many different parts of the society. And I think that took some time to develop all those contacts. And I think, and I sincerely hope that those contacts can be maintained, because I think it's incredibly important for the different agencies in Sweden to have those kind of contacts with private actors, with different parts of our society in many ways. I mean, we had contacts with restaurant owners, we had contacts with different religious societies, we had contacts with not least the sports federations and stuff like that. And I think those things were built up and worked really well. I think there was a fantastic level of loyalty in this, and that everybody really sort of wondered, what can we do to help each other in coming through this crisis? And I think that's something that we can be really proud about in Sweden. My impression is that it was less like that in many other countries, and it was more that decisions were taken at a high level and then everybody sort of had to live with that. In Sweden we work very much with I think the restaurant owners and the schools are very good examples. We had intensive discussions with both those sectors to understand what is possible to do in their context so we can reach our goals, that people meet each other less, but still at the same time damage their possibilities to keep on working as little as possible. And I think that was really something that we can take with us and learn for the future.
Coming from a risk and opportunity angle a little bit, given your vast experience, I guess it must be somewhat frustrating to see, you have been well informed. You have, 30 years ago this year, you were in Zaire working with Ebola. You have been working with infectious diseases for a long time. I guess you have been aware and tried to communicate to the society of upcoming risk, of the risk of pandemics and so forth. And talking about preparedness in society and perhaps a little bit human psychology, is there any lessons learned on how we should communicate and get the message out to companies, to governments, to the whole society, and actually being more prepared the next time around?
I think for me, one of the central things is really try to remember what you did this time. Because so many companies, so many actors found really innovative ways of keeping their business running, but still working with social distancing and minimizing risk as much as possible. So I think one of the central questions is, what did we do that works really well this time? So that exists next time.
So document the processes similar.
And so many small things that happened, and big things too, but also many small things in very local conditions where they found very good and innovative ways of keeping running, but at the same time minimizing the risk and minimizing the times you meet new people and stuff like that. So I think that's one of the central things. Then, of course, as I said, we had the weak spots and we need to work on those. Integration of new people to really understand how we communicate with different parts of our population so we don't miss out on that. I think we need to take a strong look at our elderly homes and the structures that we created there, so they are less prone to be as damaged as they were during this time. Many of them did a fantastic job, but in many places also they had huge problems, and I think there is definitely things that they can learn to be better at that. Specifically in health services, of course, this whole thing of having to keep some kind of reasonable level of stocks so that you don't have to go run around each morning looking for the face mask you need during the day.
No.
I think that's a very practical example of something that probably is not very difficult to do.
One thing that I'd like to just get your view on, Sweden and the whole Nordics, we got a sense that we were caught by surprise. And going back to human nature, I would just listed some of the main media diseases or illnesses that have been on my radar historically has been, Creutzfeldt-Jakob syndrome, crazy cow disease, the bird flu, then the swine flu. Can there be, a little bit cry wolf syndrome, given the history that we had with them? Because they were blown up very big in the media, and then nothing happened really. Have you thought around that in any way?
Yeah, I mean, this risk management and risk communication is a very tricky business because, as you said, it's very easy to get caught in this crying wolf game. At the same time, I think it's very important to keep people informed. So trying to hide these kind of things, I think, would be even worse. And there are examples of that too. I mean, if you go back to the SARS epidemic in China, where they tried to sort of hide the things, and that did not end well. So I think we need to actually keep on talking about these kind of things, but doing it in a reasonable manner and try to be very transparent about what we know and what we don't know. Trying to make forecast is a very tricky business. Maybe this is one of the most tricky areas that you can think about to do forecasts.
So what do you worry most about? Do you have any worries around upcoming pandemics or preparedness or so?
No, I'm sure that we're going to see more pandemics. We're going to see new diseases. How bad are going to get? I mean, as you mentioned, a few of them that popped up, and all of them created havoc to a certain extent. And we need to be able to handle that so we don't create havocs that are unnecessary, but still control these kind of things before they get out of hand. So my greatest worry is really that we already talked a bit about that we're going to forget. And in another 10, 20 years or whatever, something new would pop up and we're going to stand there without any stores and with an elderly care that has not changed and all these kind of things. And I think that would be really sad.
Were you surprised by any changes in power, political changes that happened throughout the pandemic, the COVID-19 that I refer to?
I mean, now afterwards, I'm a bit surprised that politically we manage and structurally we manage to stay without any major changes in Sweden. We kept on working, we kept on having the same kind of division of labor and division of responsibilities that we had normally, which is sort of the core of Swedish preparedness and Swedish crisis management. And at the time we took it, that's quite natural. Of course, we're going to follow the plans, so everybody's going to stick to their part of the work, so to speak. I was at that stage more surprised about that the power changed so much in many other countries, and not so surprised about that it stayed the same in Sweden. I really hope that's also a lesson that we can take with us, that there is a lot of good things in not having hasty changes in who is managing different things and so on, that there is a great power in people keep on managing things even in a crisis, because they know best how to adapt them, because they are the ones that really knows all the small details. And if you try to manage it from another point of view, you might really create a lot of problems. What did happen in many countries.
And another thing that just came to my mind, you spoke about SARS, for instance, and the proximity of risk, because SARS was mostly, I guess, from Nordic people, it was, a risk somewhere else. And that actually leads me to the next question, when it comes to looking at these types of risk from a global and local perspective, and also how that goes into the individual ownership and the global ownership, what the trends are there and how we should be better in treating these challenges going forward.
Yeah, I mean, you're definitely correct. And I think also the COVID did not really hit us until it hit Italy.
No.
The whole thing changed drastically when it came to Italy, and it became sort of very much also our crisis. I mean, we're living in a global village. Whatever happens somewhere else will very soon also happen to us. And I think that's a lesson we need to take with us.
And rounding off the topic on COVID-19, we will go in and discuss some other areas related to diseases and so forth. But one thing that I'm interested in, you've been very exposed to media, and you've been, out in the public a lot and have received a lot of questions. Are there any questions that the likes of me should ask you that we typically don't ask you? Is there any question that you haven't been asked that you think is relevant?
Yeah, I mean, one example is the comparison between Sweden and the Nordic countries. That's came back all the time. We try to tell media and others, why don't you look at what happens in Austria or the Netherlands, countries that in many ways are more similar to Sweden than Norway and Finland. The sort of media need to have a confrontation somehow, cloud up the message we really try to get through with.
The risks for future pandemics, where do you see them? Are they airborne, or is there totally surprises on the horizon that you would see?
I think nature is fantastic in that way. It's much more innovative than we ever can be. And it keeps on surprising us, and we should be very humble when it comes to that. At the same time, of course, airborne or this kind of person-to-person spread that we've seen in almost all pandemics is the way that disease is spread when they're most effective. Of course, we have HIV, for example, which spread completely different in a completely different way and still created a kind of pandemic. It was a slow pandemic, but definitely a pandemic. So we should never underestimate the inventiveness of nature that can definitely find new ways. And while we are changing our society and the way we interact on the international level, of course, nature will find ways to sort of use those new ways of interactions. And so, I mean, I'm sometimes thinking about, okay, maybe something in the food area. Food is transported and spread all over the world in many ways. So maybe nature will find something there that will create a pandemic.
That's a very interesting thought, I would say, because that will have impact on supply chains and how we think around transportation and so forth. So you were talking about nature, and that actually comes me to think about climate. And we're all aware about the climate change right now going on in the world. What are your expectations on how climate change will affect the pandemics and the transmission of new diseases and so forth? Could be migration, but also transportation.
Yes, definitely. And I don't think we know all of them yet. So far, these kind of extreme weathers have been caused most problem, not least the heat waves, which many countries are not prepared very well to, including Sweden. When it comes to pandemic, I think climate change probably will push people into new parts of nature where we haven't been that much before. And coming into new kind of nature, new kind of ecological niches, we will encounter new kinds of pathogens. And those might be the kind of pathogens that can adapt to humans and start spreading between humans. So I think there are many parts to the risk of pandemics, but that I think is one part that's quite obviously going to be affected by climate change, because climate change is going to force people into new areas of nature, new places on Earth where diseases might exist that can adapt and can create pandemics.
And you were mentioning potential new diseases or pandemics coming out from food, for instance, and that gives me the reason to believe that the corporate society, big corporates around the world, perhaps should think more around these types of risks and rethink the concept of a pandemic. Are corporates doing that enough, would you say, or are there any lessons learned how we could actually interact and collaborate better with public health agencies or with the medical system to build a stronger resilience against this?
I think the main trick here is really to find things early, because to stop it from happening is not going to be very easy. There are some things we can do and are partly done already, and that's to try to separate humans from big groups of animals, for example. We know that this huge chicken farms and US pig farms and so on are potential breeders of or spreaders of pandemic diseases. So to have this kind of good environmental hygiene and strict sort of restrictions on how you meet in those are important, and that's where I think big companies are very important to sort of see to it that comes into place, so that humans meet especially big groups of animals less. I think that's one way. The other part is, I think, to have this kind of communication that we were talking about, keeping each other in the loop of what you see. Because, of course, corporation and big companies like that, they have a lot of data coming in and out, and they see things that would be very good also for the public health authorities and so on know about. Examples can be a sudden increase of disease in part of their workers' population and stuff like that. So I think to have this close collaboration and close interaction and close sharing of information would be very, very good and essential to find new things as soon as possible, because if we find them early on, at least we have a sporting chance to stop them.
Yeah.
Once they are at the level that COVID very quickly became, there is no stopping a pandemic.
And I see a risk in us as humanity looking at risks, one by one too much. And we've been talking about collaboration, looking at wider forms of risks, and have perhaps better split vision to not be caught by surprise of tomorrow's risks. And looking into your work history a little bit, you've been researching on biological weapons like anthrax, for instance, and historically there's been a talk about nuclear, biological, and chemical weapons from a warfare perspective. You don't hear too much about the biological hazards these days. It was a big thing after 9/11 with anthrax, for instance. But it's been more talks about nuclear warfare, given the proximity and the war ongoing in Europe right now, and also chemical warfare. But the biological warfare, should that be on the agenda still, or what's your view on that?
When we talked about it, we didn't quite realize how difficult it is with finding effective biological weapons. And the things you're talking about, like nuclear devices and even explosives and so on, are so much easier to find and to handle and to use. So I don't think it's so surprising that very few terrorists went and looked at the biological possibilities, because they are very difficult. I mean, it's difficult to find a good pathogen that will work very well in a weaponized way, and it's even more difficult to spread it in a way that's really dangerous and so on. So I'm not surprised that it's sort of come down on the agenda, and I think that's quite logical. Nature is much better at this than humans will ever be, and nature will most likely cause the most of these kind of problems even in the future.
I'm not sure if that's comforting or not.
So I'm not really. I mean, the threat of it, like the anthrax letters, might cause a lot of problems. So we definitely need to keep an open mind about it. But the actual impact of it would probably be rather restricted, I would guess. I mean, state actors are getting more and more unpredictable, and maybe some of them will also start looking at this. And of course, a state actor, with all the resources and possibilities and knowledge they have, they can maybe be able to create something. But as I said, there are so many much easier ways to create havoc than to try to create something from the biological side. So I think that's the reason we haven't seen very much of it.
So you're not too worried about foreign states going in and contaminating water reservoirs, for instance, or?
No, more and more the havoc, the threat of it will spread. And I think that's what we see in Sweden already, that somebody's breaking open a door. You don't have to put anything in the water. It's enough to break open the door to create havoc.
Human psychology and nature are our biggest enemies, to conclude with. No. Thank you, Anders, for those comments. Switching subject somewhat, actually going into the societal part of how we treat these risks, and also discuss a little bit more critical challenge and public health challenges that we see. And going into perhaps the hornet's nest, talking about vaccination programs. Are there any weaknesses that you see in our current vaccination program and the communication around vaccination?
Both yes and no. I think we in the Nordic countries have been probably one of the world's most successful users of vaccines. We have gotten rid of terrible diseases like measles and smallpox and a few others with the help of vaccines. And we are still having a fantastic level of adherence to our vaccination programs. So I think we are doing a fantastic job in the Nordic countries when it comes to vaccines. Definitely so. I don't know if you've seen it, but I did a government review on vaccination programs in Sweden recently, and I think what we found out that is the problem with Sweden is that it's quite a heterogeneous way we have of handling vaccines. I mean, the states sometimes pay for them, sometimes the regions pay for them, sometimes you have to pay for them yourself and so on. So, and this is what we really pointed to in this review, that a better collaboration around, so that the public, the person at the very end of it, can understand better what kind of vaccines are recommended for them to take, and do not really have to think too much about if it happens to be the state, the region, or themselves who has to pay for it. So this kind of coordination, I think, would be beneficial for the future for the vaccination programs in Sweden, especially now when we're probably going to see a few more vaccines coming in, to introduce them in a more coordinated manner so that the public understands that this is a good vaccine to take and don't have to think too much about, is it the state's going to pay for it, is the region going to pay for it, is somebody else going to pay for it, or do I have to pay for it myself?
Being a heterogeneous group, as you refer to, we're a big crowd, easily steered. I know that you mentioned in other interviews the challenge between the individualism and solidarity and how that has worked, because I think that also was a big part of the discussion in the public debate, at least when it came to vaccination. And could you elaborate a little bit on your thoughts on that, where we're going, what's your view on how we should think about me as an individual and the solidarity thinking there?
Yeah, I mean, vaccine programs comes back to that. To a certain extent, it is about solidarity, that we all get vaccinated. And I think the pandemic in many ways shows that this solidarity to a great extent still exists in Sweden and in the Nordic countries. Even if we all talk very much about people becoming much more and more individual, when we get into a crisis, when we really see the need for it, people are still fantastic about that even if it's not going to help themselves very much, they can still stop going to the store every day and keep distance to protect our elderly, for example. So I think the feeling is still there, and we need to foster it. We need to acknowledge it and also take it very seriously so we don't overuse it. And I think that's why when new vaccines are coming along, I think we need to have that discussion very clearly. Who is going to benefit and who is not going to benefit, and where are the risks and where are no risks, so that we are very transparent about when new vaccines come, about all these different aspects of it.
And would you say that our mindset has changed? You referred to the world as one big village earlier on. Do you see a conflict there between, so to speak, the family, if say a country or even a municipality, and the global aspects? Because we are dependent on each other, but how can we get that into our awareness and also build that as a part of our risk preparedness for the future?
I don't think the two really need to have to stand in opposition of each other. I think you can handle both, but once again, you need to be very transparent about it and to see to it that, for example, vaccines and different kind of countermeasures really end up where they are most needed. That's something we didn't do very well during the pandemic. I mean, all the vaccines ended up in the rich countries, and the poor countries got very little of it and very late. And of course, we need to sit down and discuss that better, because to protect the global village, you need to really steer the vaccines or whatever countermeasures to where they are most useful, because that will, in the end, protect us all.
And with that note, I think it's also very interesting. You mentioned earlier also that we should be quicker in actually identify new risks. And would you say that we have a democratic issue there? If we were quicker, on the ground where the outbreak was, let's say ground zero was Wuhan, if we as a global society were quicker and could confine those outbreaks, would that be something that we should think more about, actually being quicker rather than having those global pandemics?
I think experience tells us that when a disease has the possibilities and the capacity to spread like a pandemic, we cannot contain it. So I think that these kind of measures can slow things down. They need to be done in a way that's not harming people more than absolutely necessary. But most of the time, when we see them like that, they are already, if the disease has the capacity to spread wider, it's usually already outside of the area where we see it. So I think when I'm talking about that, we need to see it quickly, and then so when I talk more about that, we need to share information about it so we understand how it works, so we can really tailor our countermeasures in the best possible way, that we can understand who is the risk group and how is the spread going, and so we can close down the right kind of things and so on, so stuff like that. But trying to contain it by locking people up, no. That's I don't think that's possible in the global village we're living in.
No, it's an open village. You were touching on that competence, actually. Do we have the right level of competence to handle both upcoming pandemics and aging population, both in Sweden, the Nordics, Europe? That equation, does it sum up, and how well prepared are we from a competence perspective?
I think we are reasonably well prepared, but I mean, this preparedness also comes back to very much this thing about the global village, that we really need people who have worked in this global village, because when they come back home, they take with them a lot of experience, a lot of understanding, a lot of knowledge, that it's going to be very useful and very good for Sweden to have. So I think we really need to keep on fostering that we need also to enable young people to go out and work in different parts of the world, because that's really going to improve the way we do things in Sweden very much.
Now, leaving the unknown risk for the future and zooming in on an actual risk that we all are aware that is imminent, namely antibiotic resistance. What is your view on that, Anders?
No, but this is definitely one of what we sometimes talk about, the slow pandemics. Slow crisis, slow pandemics like that are a lot more difficult to handle because they are not that acute, and nobody is really prepared to do these kind of drastic things that you do in an acute crisis. So they are much more difficult to handle, and they also take a lot more resources because you need to keep on fighting it. I mean, we cannot stop antibiotic resistance. We can slow it down. We can compensate for it, but it's going to happen. It's one of nature's way of adapting to threats around it. So I think that's what we need to understand. The fight against antibiotic resistance will never end until the day we find a kind of cure that's completely different, but we are nowhere there. So it's definitely something we need to work on. We have done very well in Sweden for a number of reasons, and that we have also, I think, been fairly good about taking that knowledge with us when we work with countries in other parts of the world. But this is also definitely something where a good collaboration with the private sector is so extremely important, because many of the risks and so on that we see with antibiotic resistance is very much connected to how you handle different things also in the private area, not only in the hospitals.
Is the private sector taking the responsibility? I'm often asking, who should take on the lead here? Who is responsible? The private sector, I think it's similarities to the green transition. Are we incentivizing large corporates and companies enough to actually assist the healthcare system in mitigating the antibiotic resistance, or should there be other steps taken?
It's always very much coming down to economy. So I think we need to think about it in that way. If you're not sort of doing the best you can in this area, it should also cost you, so to speak.
Yeah.
You should be willing to pay for better performance. That will also, of course, that better performance will also include better ways of stopping or minimizing antibiotic resistance development. We all have to be prepared to pay for that and things like that.
And if I just rephrase it, perhaps so it lands more within your area of expertise and your experience, when you have met corporates and seen the development of COVID-19, let's say in Sweden, and the antibiotic resistance, have you seen or got frustrated that things do not happen in the right pace? I'm not saying that you should solve for the problem, but have you identified any areas where we actually could be better and make sure that the companies are more motivated to drive this?
No, I think my experience is that many companies are quite interested if the incentives are there and if the damage to their market and so on is not going to be very big. So No, I think that a continued dialogue like that can definitely improve things.
To conclude our conversation, I'm just interested to learn, are there any specific things we should think about or do not forget about for the future?
I think we should all remember how well we worked together during the pandemic. I'm still incredibly impressed how the Swedish population managed to change their lives and lifestyles and to protect themselves, of course, but also to protect the whole of society. And I think that was a fantastic experience and something we can be very proud about, all of us, and something we should carry with us into the future.
Thank you so much, Anders. Team play.
I enjoyed this interview. Very nice talking to you and seeing this from a slightly different perspective.
A big thank you to all of you listening or watching as well. Thank you for this episode.